Welcome to Centennial Oral Histories, a series featuring former and current leaders of Duke University and Duke Health, sharing memories of their time at Duke and their hopes for Duke's future. Enjoy this discussion with Dr. Eugene Washington, who served as Chancellor for Health Affairs and President and CEO of Duke University Health System. He is interviewed by the Reverend Dr. Luke Powery, Dean of Duke Chapel.
Good afternoon. I'm Luke Powery, and I am here with Dr. Eugene Washington for the Duke Centennial Oral Histories program. Gene, it's great to be with you this afternoon and to hear some of your story with Duke and all of the many intersections and the impact you have had here at Duke. Well, and we can talk about a lot of things.
It's just terrific for me to be here with you. And
Great.
I just feel honored to be a part of the program in Duke's rich history.
Wonderful, wonderful. There's several things we can talk about for sure. But I think it would be helpful just to begin to share a little bit about your kind of career journey and to reflect a little bit on how did you find your way to Duke, or you could frame it another way because you are a preacher's kid like I am, and reframe that to say, what led you to Duke? How did you find your way here?
Yeah. Luke, my professional journey dates back to my childhood, where I grew up in Houston. But as you know, I grew up in a segregated Houston, the son of a minister. I also grew up in a community that fully embraced the WB's Du Bois's Talents at 10th philosophy and principle, which meant I grew up with some extra attention on me, focused on the idea that I would excel, work hard, and achieve, but all with the aim of elevating myself so that I could in turn elevate, WB called it the Negro race, but elevate African-American Black people. And over the course of my life, my principal drivers have been achievement or excellence, but also how do you leverage that to have impact. Leaving Houston, I left with this idea that I was going to eventually become a physician and be an ambassador for the Black community in terms of serving the Black community. I eventually finished medical school, but in medical school, I discovered that there was a better way for me to possibly have impact in the Black community than just treating individual patients. And so I broadened my lens to that of a public health lens, which was more consonant with the idea that it was not about me, but it was about lifting. Again, originally it was the African-American community, but that lens broadened as well across my career. And with that in mind, I eventually went to public health school while I was in medical school. And for the 10 years out of medical school, I had a career in public health. I worked at the Centers for Disease Control as an epidemiologist and as a clinical investigator. So I kind of think of that as phase one of this professional career journey. Phase two involved me going back to retrain in clinical medicine, and there's a whole story around that. But it was really prompted by the recognition that public health had a macro view of things, but I also wanted to combine that with a micro view in terms of taking care of patients so that I could bridge these two worlds. So went back, completed a residency, as an old man in gynecology and obstetrics, and that became the beginning of the second phase of my career, which had to do with more clinical research, but also a focus on patient care. In my case, it was particularly women's care and reproductive health. Somewhere along the way in that journey, someone observed that I had some facility or skill with bringing people together, organizing them around a common mission and driving, helping to drive the group through to completion of what the goals were. And with that, I then assumed several different leadership and management roles as the department chair, but then eventually, I was a dean. I was also executive vice president or provost, executive vice chancellor in this case, at a university, which really ushered in the third part of my career and journey, which I've been on now for the last, I would say, almost 2 decades. And that is executive and senior leadership roles in large academic health systems. And if I come full circle, that has allowed me platforms at various levels to help people, to help drive excellence, but importantly, to have impact. And what eventually brought me to Duke was an opportunity for me to leverage what I'd been doing in the research world, what I'd been doing in the clinical world, and what I was beginning to do in the community and public health world as a combined entity. But at Duke, the role, the Chancellor for Health Affairs, allowed me to work with a team of leaders who could oversee each of those without me having the day-to-day responsibility for it, but could guide, in this case, Duke Health in the broader engagement of all of our mission and mission areas with the community. And the community in this case particularly meant Durham and the local community, but it also meant communities globally.
Well, you have quite a journey.
I'd like to believe that I'm still on it, Luke. Yeah.
You're still on it. You are.
Yeah.
When you came in 2015, I believe, what were your initial goals as chancellor?
Yeah. At the highest level, it really was to work with just a phenomenal, really, group of colleagues who had already excelled. And when I'm saying group of colleagues now, I'm talking about faculty, but I'm also talking about staff, and I'm talking about trainees, to establish Duke, and in this case we were Duke Medicine at the time, you know, in that top group of institutions that were achieving at the highest level in research, but in education and also in patient care. Building on top of that, a priority for me, and I would say the larger goal for me, was to intensify our efforts on health. So much of what we were doing was focused on our individual missions, and we were great at taking care of patients, and we were great at discovery and driving innovation, and we were certainly great at educating our students and residents and other trainees. But we didn't see those as a means to an end. In many cases, those were the end. And I'd envisioned that we would intensify our attention on the concept of health and see those as a means to an end. And in focusing on health, it would prompt us to think a little differently about how we saw research, about how we saw patient care, and about how we trained our students and our other trainees. And the big difference being, it prompted us to think about those social and economic determinants of health that go beyond the traditional ones that we had thought about for so many years in medicine. And so that became really a principal driver for me and for the organization in my early years. And that is one of the reasons I was attracted to Duke.
Yeah, wonderful. Yeah, I was here for that shift.
Yeah.
I remember that shift. And speaking about this kind of broadening on so many levels. I mean, what you've done here, and you've gestured towards it just now, beyond the medical care into areas of population health improvement. Could you name some of the most impactful moments in this journey, that change, which you've mentioned, Duke Medicine to Duke Health, the founding of the Population Health Management Office, launching Healthy Duke? I was connected to that, I remember. Were there particular moments in these transitions that stand out to you?
Yeah. One that comes to mind is as a result of, I would say, 6 to 8 month effort, working with leaders across the medical school, School of Nursing, health system, but also the university. We, without any coaching from me, even though we were on this journey together by then, we transitioned from Duke Medicine to Duke Health, where we described our mission as advancing health together. That was a critical moment. In January of 2016, it was like a manifesto. We announced that this was more than just symbolic. It meant that we were going to place this additional emphasis. But we quickly turned to how do we translate this into real programs and activities. And we thought about it in terms of populations. And there was 3 overlapping populations. One population was the population of people in our community. So that's right here at Duke. Another population was and is the population of patients who come in and out of, we're talking about millions of individuals over a given year, our health system. And then the third population was the community that we serve. And so working with some really talented but also dedicated individuals in each one of those areas, we say we need to give a little structure to it. So Healthy Duke was about how do we make Duke university community. It's our faculty and our students and our staff and everyone. And had a great partner there. Always had really remarkable partners in each of these major endeavors. When we thought about our patients, that led to the creation of the Office of Population Health Management, which was designed to get away from the clinical enterprise itself and work more out in homes and in the communities where we could go upstream and really see how people lived in their homes and better assess what their needs were beyond just the medicines that we were giving them. And then similarly, as we thought about the population in the community, we developed something or an entity or an effort called Healthy Durham. In fact, it became Healthy Durham 2020. And we tell the story that, when we started with Healthy Durham 2020, it was all the things we were going to do by 2020. Well, we had been moving a little slower than we thought, so by the time we got to 2020, someone came up with the ingenious idea that 2020 stood for, we had 2020 clarity of vision now about what we wanted to achieve. So it remained Healthy Durham for 2020 for a long time, but it encapsulated what we wanted to do in the community, and it became the foundation for efforts that are still underway and thriving right now.
Eugene, you have said quite a bit already about the community and that broadening of Duke Health into the community and even homes. Could you say something about Duke's relationship with the Durham community through the lens of healthcare and health equity? Say some more about that.
Sure. Well, it begins with the fact that we are what we call an anchor institution. I'm talking about Duke University and the Duke Medical Center, which is in this case Duke Health. And from a healthcare perspective, we provide care to 85+% of the population here in Duke. It's a responsibility that we take quite seriously. And the good news is that from the community's perspective, they not just depend on it, they expect that we are going to take care of them and help them to not just only be healthy, but to thrive. We are the largest private employer. And so there is, from both sides, a sense of expectation. And over the course of years, we have been better aligned in where we thought we were relative to delivering on the expected outcomes. I was quite fortunate in that when I arrived, the relationships with the community were quite good, as I see that they are right now. And I benefited from having a champion who was a bridge for me, Marianne Black, who was just admired and respected in the community. So I arrived with some credibility just in walking the grounds with her. But to your question, when I think about our mission, again, I go back to our mission. It's to educate the future generations. It's to drive discovery and innovation. It's to improve healthcare and deliver the best healthcare. But it adds up to me to improving the health. And we can't do that without working in sync with the community. They understand the needs much better than we do. They're more knowledgeable in so many areas than we are. And it is that collaboration that has allowed us to not just achieve our academic missions, but to have the impact and deliver on the expectations that are there. So I'm proud that I've just seen our institutions, I'm at Duke Health, but the broader university, and obviously we're a part of that, increase and intensify its efforts with our, not just our Durham community, but certainly the communities across the Greater Triangle in North Carolina. But we've seen the same with our emphasis on global health in the communities that we're serving around the world.
Yeah, thank you. Thank you for that. Beyond, or let's say interconnected to Duke Health, which is in a broader sense science, if we think in that way, there's been this wonderful, the partnership and kind of propelling in partnership with the then provost, Sally Kornbluth, who was provost at the time, to launch the Duke Science and Technology initiative. Could you describe what that is and how that effort will strengthen Duke's capacity in the future and in service?
Sure. Well, you mentioned Provost Kornbluth, Sally, and we were definitely insympathical. She was like a co-pilot. I was the other co-pilot. If anything, she was the pilot and I was the co-pilot. But we both recognized that while we were doing very well in our scientific community, we were in a group that had picked up the pace. I'm a cyclist, and so it's like you're riding in that front group and they're out of the saddle, and you don't get out of the saddle and pick up the pace, you get dropped, and it's really hard to catch up. And that's as a result of some recruitments that we had lost, some retention efforts, and also some metrics that were suggesting to us that we were still in the top group, but just not moving at the same pace. And fortunately, with support from the president and eventually the trustees, we determined that we wanted to make the necessary investments, principally in people from the beginning, but also in programs and eventually in facilities. Luke, why did we want to make those? It wasn't just about being in the pack and being in the ranking. Again, I go back to having impact. There are some huge problems that society face right now. And underneath them are just questions that need to be addressed in order to drive solutions to those problems. And that's where science comes in, across the spectrum, from discovery science all the way up through translational science to population science. And the principal ingredient of successful science is people. And so this initiative has been very, very much about investing in science and scientists at Duke already here, but also in deepening our resolve to be competitive in recruiting the best of the best in the scientific world. But beyond the people, this initiative also allows us to reorganize efforts in certain areas to give more focus with the idea of driving more impact. Computing is one of those areas right now. We expect they're going to change just given what's happening right now and the advances that are being made in that area. Another is material science, which many don't recognize to the degree to which how it affects our lives in so many ways, including in terms of how we deliver healthcare and materials and instruments that we use in healthcare. And a third one, and again, look, emphasize, these are just areas that are at the beginning. But a third one is around resilience. And we think of it as body and brain resilience. And what that has allowed us to do, or the university and colleagues here, in focusing on those areas, is to really elevate our performance in terms of the synergies of the science that's underway in those areas so that we could accelerate discovery and accelerate innovations that accelerate solutions and adoption of those solutions to eventually have the impact that we want to have in some key areas. So it's an important endeavor that's in many ways still in its infancy, but it's been supported and we're beginning to see the payoffs.
Most definitely. Okay, that's great. You have talked about 2020. You said to your 2020 people several times, and then you just used the word resilience. And I can't help but think about the COVID-19 pandemic when I think about that combination. How did Duke Health help the university community, the Durham community, successfully navigate that pandemic? And what are the lessons from that period that you think are most important?
Yeah. If you don't mind, can I start with the last one?
Oh, for sure.
Because a key lesson here, and it's something we say, but we lived it, we're stronger together. And it was a reinforcement of that because of the way we responded. And I'm talking about Duke University writ large here now, and Duke Health's a part of that. But the way we came together, first around just figuring out what was going on and how best we could take care of our people. And our people in this case, again, meant those three populations that we talked about. So it's our own citizens on the campus, it's our patients and their families, but it's also our community. And it, again, underscored the strength that we have and the power that we have when we draw on the disciplines all across Duke. I mean, and across all the professional schools, along with, including the college, where we engage our students. And so that would definitely be, and that was needed. It was out of necessity early on. Some of the specific ways that Duke Health contributed to the efforts more broad on the university was, one, we forget often that there was a shortage of tests that were available. And so you didn't have results in terms of who was positive and who was negative. You didn't have a reliable surveillance system. If you're, which you are, responsible for the students about whether you continue to go with classes or how you manage them, or will you send everyone home? And Duke Health, as well as some scientists or laboratory-based researchers, came together and came up with some preliminary testing just to help guide those kind of decisions. So from a scientific point of view, we contributed in that manner. The other was, it was quite confidence building to know that you got this medical center, so that when someone tested positive or someone was ill, you weren't sending them off to an unknown entity. We had protocols that were in place to ensure that students, in particular students, but also faculty and other members, were treated very promptly. We were part of building out a quarantine network. And so we contributed in that manner too, in terms of taking care of individuals, but importantly in terms of focusing on how we could prevent the infections.
Yeah, it was quite an experience, and I remember on some of the calls that would happen, the senior leadership group, at times you were reminding those of us on the university side that we've never gone home. Like that you could forget. Yeah, there is no remote when you're talking about the healthcare system and the care for people during this time. And I remember you saying that, having that refrain at the right moments to help us all. Now, I realize that the pandemic season, COVID-19, was really a challenging time, right, for everyone in so many ways. And maybe there were difficult decisions or challenges, then. But could you think about your time as chancellor? Were there other challenges that you faced as chancellor, or difficult decisions that you had to make, or issues to deal with during your season? We'll get to the challenges. We're going to get to the joys too. Don't worry.
Yeah. If you go back to we talk about people, the most difficult decisions you make are, in these leadership roles, they're connected to people. But beyond people, there's difficult decisions you make around resources. So, but let's take COVID when it comes to people. COVID led to a shutdown, which meant we weren't operating on patients as much. We weren't seeing as many people in clinic. We went to telehealth. I mean, fast forwarded very quickly from 200 or 300 people in a month on telehealth, to 3,000 a week. It was phenomenal, just that shift. But it meant people weren't coming into our clinics. It also meant that our staff weren't coming to work as often, which also meant in turn that our revenues, they just plummeted. So one of the toughest decisions was how do we manage through this period with decreasing resources, but yet we've got people we want to take care. I'm proud to say that, with strong support from the executive team and from others across the institution, we did not lay off anyone during the pandemic. In contrast to many, if not most of our peers, including locally, they had reductions in force. That was a tough decision, but we felt it was in line with our value of taking care of our people and our communities. And so that would be an example of one related to people, but also related to resource use.
Yeah, most definitely. What would you say in thinking about Well, let's just go to the joys. We'll get to some other. Let's do that. What would you say were some of your greatest joys here as chancellor and being at Duke?
Yeah. You mean besides Cameron and basketball game and Beulah Trail? I'm a big
There's
walker,
like God, and then there's Cameron.
Yeah. It's they relate to seeing people be successful, and I've talked a lot about leadership and the executive team, but they're examples of just staff. An example here was a group of staff, along with some support with faculty, put together a film called Housekeepers. And it was just so moving to see how that community of individuals who take care of, kind of the invisible people, taking care of the institutions, taking care of us, taking care of patients, taking care of the food supply, come to the fore and tell their stories. And with the support of just a couple of the executives, that brought joy to know that we had a community of these individuals like this here, but that we had the community spirit to celebrate it and bring it to the fore. So, stories that involve those not in the limelight all the time, being successful, certainly brought me joy. I can think of examples of students who organized themselves. One of the programs that we had as part of our population health and community efforts was we supported something called Chancellor's Community Fellowships. And a couple of times a year, I would go to them and they would present where they are in terms of their projects. And there was one project where they provide food every Saturday morning out in the community. And I had encouraged them to invite me, and they did. And so in this case, it was a Saturday morning, we gathered, and it was just joyful to see not only the students who were there, but the community leaders and the farming community who were bringing in produce and bringing in other things that were being bagged to deliver to patients and to deliver other individuals in the community. But there were also individuals who knew to come to this distribution center. And as part of that experience, I wrote with 2 students on a delivery route. It just brought great joy to know, again, these are students at Duke who are living the mission, and to see the way that crossed over into our community and was having impact as I visited a household and saw the joy on their faces in receiving these gifts of nourishment. So in particularly, I think about examples of individuals that are, kind of laboring in the fields away from the spotlight, but yet truly living our mission.
Yeah, that's powerful. Thank you for that. I did not know about the Housekeepers
Go see
film.
it.
I definitely want to, because they are keepers of the house.
They're keepers of the house.
For sure.
Yeah.
One of the things which I know was maybe a joy and a challenge. One of your final achievements, if one might say, as chancellor, was the creation of the Duke Health Integrated Practice. Why was the integration of Duke's physician practice, the health system, and the School of Medicine so important for Duke, its future, and importantly for patients?
Yeah. Again, let's start with the patients. Delivering high quality health care starts with being able to see the doctor or being able to see somewhere in the system, the nurse practitioner, whomever, the physical therapist. Without this integration, we were already suffering with access problem. The waits to get in to see us were long.
Okay.
So that's one, access, and I'll explain why. The other thing is patient, I want my care to be seamless, and which means I want it to be integrated. Okay, and our physicians, best in the nation, but still not as integrated, and so the care was not seamless when it came to delivering it across the healthcare system. This integration was going to, or has,
Right.
brought us so that we aligned in mission. And it was critically important to improve the patient care because those access problems were there principally because the physician organization by itself could not grow. It didn't have the capital. And the laws didn't allow us to support it in its growth as a separate entity. With the integration, we were able to accelerate recruitment. In fact, just this past academic year, recruited 390 physicians. It's just amazing.
Wow.
This was an increase of almost 20% over our base. But it's meant that our access problems and the waits and the time to get in to see different specialists just is plummeting. And so the integration was critical for us to provide the highest quality care that we had been providing. But there was another reason, and you mentioned this about the future. Our competitors, again, going back to just looking at the landscape, they were expanding, and that expansion, particularly through partnerships, was dependent on integrated systems. And so for us to attain the scope and the size and be competitive and to forge those partnerships that we were going to need long term, and that's happening right now, this integration needed to take place. And I'm delighted to say that the reports I get now is that we are, we're moving forward and upward. We're headed beyond.
That's great. Wonderful. I know that was a big accomplishment.
And today I can say I feel joy for talking about it. Back then it was a different story.
I understand. Well, here you are, so no longer the chancellor.
Yeah.
But not retired. You've put on new tires.
I've been in a period of renewal.
Renewal.
Yeah.
Right. You love that word. That's right. Renewal. Yeah. And can you share a little bit about your current research efforts that are related to climate and health? I think this is so critical that someone who was in such a role and just your journey that you laid out for us, and at this stage still doing research, still new projects emerging and relevant for our time.
Yeah.
Could you speak a little bit about what you're working on and in your research?
Yeah. I will acknowledge when it comes to climate and climate change, I'm sort of a Johnny-come-lately. I didn't have a deep awareness of it and was not motivated to take action. But when I became aware of it a couple of years ago as a result of being asked to participate in a discussion through the National Academy of Science about what the healthcare sector might do, I walked away aware of the problem. And as a colleague said, once you become aware, you can't undo that. And so as I was transitioning to this period of renewal, I thought about what are some of the big problems right now. And it just happens that this is about the time that Duke is making its commitment to climate and launching a major effort. And I, wrapped up this thinking by connecting it to where I started, with big populations and public health problems. And if there ever was a public health crisis, actually, climate change is both a public health and a humanitarian crisis. And so I had the benefit of a sabbatical, which allowed me to do some, not just deep thinking, but collaborate with some others on coming up with some projects. And so at this point, I'm engaged in climate change and human health, all with the aim toward how do we identify and how do we evaluate and study solutions that accelerate action that promotes human health. And right now, projects in three areas. One is when we look at climate and carbon emissions, the healthcare sector in the U.S., about 8.5% come from the healthcare system, these big health systems. And the largest of the healthcare system, particularly in terms of carbon footprint, happen to be the academic health systems, because we have intensive research enterprises, but also because we take care of more seriously ill people. And so we just have more waste that we have to dispose. We use more energy. But yet, we just, like I was not as aware, we as a community of academic health systems and leaders have not been as aware. So I have helped to spearhead an effort that is accelerating action by the C-suite in academic health systems. And in partnership with a couple of national organizations, have formed the equivalent of a coalition to drive this activity, which is aimed at, as we say, educating, activating, and arming CEOs to take action. Another area, given my discipline, is in reproductive health. And again, with support from across Duke, but particularly in the department that I'm in, we've launched a new effort. It's the Climate Action Collaborative to promote reproductive health. We see the problems globally as it relates to infertility or fertility, but also in particular as it relates to maternal health and pregnancy outcomes. But we see it immediately right here in Durham, and we see it in North Carolina, the degree to which heat and pollutions are leading to adverse pregnancy outcomes, both for the mother, in terms of regrettably greater morbidity and mortality, and for the infants in terms of premature deliveries and low birth weights. And guess what? There is just widespread inequity. These consequences are disproportionately hitting the most vulnerable of populations, widening an already alarming and disquieting disparity that's there. And then the third area relates to what we're doing to what we call building observatories for climate action in order to intervene in places literally around the world. This started off as a global project, working particularly with colleagues in the Global Health Institute. They took me with them to Amazon about 3 months ago, so you could see what's happening ground zero. But through these observatories, we can determine what are some targeted areas for interventions. And not just in the Amazon, but using Duke's footprint or platform in Eastern Africa, which is where another major rainforest is, in the Congo. We're launching similar kind of programs there, and using our platform in Singapore, which is adjacent to the other major rainforest, which is in the Indonesia area. We are launching major programs there, all with an idea to how we, working again with local communities and governments and officials, how we can build these observatories to more quickly and more clearly define what the problems are, identify solutions, test them, and then launch interventions.
Wow.
I'm having fun.
See, you are being renewed.
I'm
For sure, you are engaged. I love it. This is the Centennial, obviously,
Right.
For the university. Significant time of celebration and reflection.
Mm-hmm.
What would be your hopes for Duke Health, in particular, but the broader university, for the next 100 years?
Yeah. It would be the same. It would be for next year, for the next 10 years, for the next 100 years, that we be the best at making individuals better. Whether it's the students, or whether it's staff, or whether it's other trainees, or whether it's faculty. And by better than who they are now, so we're helping them with their growth, but we're supporting them in their endeavors. And it's better in how they live their lives, and it's better in what they contribute as citizens, and it's better in how they help create the future. And so this concept of making individuals better in turn makes our communities better, and in turn, first it makes our institutions better, including Duke, but it makes our communities better, and in turn makes the world a better place for all.
Mm-hmm. Well, you emphasized even there about making people better. All throughout your sharing today, people has been a theme, a thread, which came through so clearly. You have been a remarkable leader here, doctor, researcher, teacher, but most of all, you have been a phenomenal person. And so thank you for all that you've done for Duke and so many other institutions, paving the way for the next generations. And thank you for sharing and spending this time with me this afternoon.
Well, thank you, Luke.